Now let me bring in Ron Klain. Ron is the Executive Vice President at Revolution and was the White House Ebola Response Coordinator in 2014 and 2015. Ron, it's great to have you with us here today.
Thanks for having me, Jeanne.
You are, of course, an advisor to the Biden campaign, and I'd like to talk about politics just a little bit. Obviously, physical campaigning is just a no-go. Can't go out there and kiss the babies and shake hands. Is that going to radically transform the nature of this presidential race?
Well, obviously, it changes how candidates for president and for all offices in America have to campaign right now. They're campaigning digitally. They're getting their messages across by putting out videos and doing virtual events like this event that we're having here for the Atlantic. And so I think it's changing the nature of the campaigns, but I don't think it changes the substance of the presidential campaign. I think we've seen over the past couple months a pretty clear difference develop between Vice President Biden and President Trump on how they would approach fighting the coronavirus, on what they would do in response to it, on what their ideas are about the public health response, about the economic response, about their styles of leadership. And I think that choice is before the American people very, very squarely. It's a very stark and really sharp choice between these two men and the kind of presidency they would have. And I think that is coming through loud and clear on whatever mediums it's allowed to be transmitted by right now.
But the president has 2 hours of television time, sometimes more, virtually every day at the White House. How does Joe Biden, even through the wonders of digital communication, counter that kind of free media?
Well, again, Jeanne, I think it's not a question of quantity, it's a question of quality. I think when the president uses that time to mislead the American people about what's happened, to mislead people about his record, to thrash out at reporters, to make almost everyone the enemy except the virus, not sure he's really doing himself any good politically. I know he's not doing the country any good in terms of fighting the virus. With all situations with an incumbent president, he's going to be judged on his record. His record on fighting coronavirus is one of long delays, downplaying it, denying it, eschewing scientific advice, not listening to his public health advisors, and us paying the price for it. A minute ago, Ed was talking about this tremendous gap we have in our country on testing. Why do we have that gap when Korea doesn't, other countries don't? That's because of choices and a failure of leadership that President Trump made. So I think the record's going to speak for itself, and I think that contrast is going to be very, very clear.
The vice president laid out the nuts and bolts of his plan in an op-ed yesterday. It was very nationally focused. You know better than most that this is a global pandemic. Does he have to have a global strategy to deal with this? And does the president need one?
Yeah, so Vice President Biden laid out his plan to deal with the virus in mid-March, March 12th, and people can go to joebiden.com and read it. And that included an approach on global health security. It's something that he and President Obama have been very focused on since 2012 when they first launched the Global Health Security Agenda, and of course is expanded by the Ebola response in 2014 and the ways we built on this. I think, Jeanne, this is right. I mean, right now, we in America, understandably, are focused on the impact that this virus is having on us, on our health, on our families, and on our economy. But it has to be seen in a global context. It will do us no good to fight this virus in the ways Ed was talking about a few minutes ago here at home if it rages overseas, because in that case, it's just going to come back. It's an interconnected world. So as we pursue solutions, first and foremost, I think in our political system, those solutions are about protecting the American people, taking care of us. But in the long run, what makes America safe is global health security. What protects us is doing a better job of detecting diseases overseas, isolating them, and responding to them quickly. And it was a failure to have that system in place, a failure to engage the Chinese aggressively enough about that is one of the key failures of what happened with the coronavirus.
Was it also a failure of the World Health Organization?
I think the World Health Organization had some things right and some things wrong. And I think that certainly I publicly said at the time, they did not declare this a public health emergency of international concern as early as they should have. They should have done that more quickly. They should have pressed China for more transparency and more answers. And I think that has to be looked at when all this is over. I do think that there are weaknesses in the WHO. One of those weaknesses is really not the WHO's fault. One of those weaknesses is that they're not really a response agency. They are a regulatory agency. They identify problems, they report on problems. But I think one thing that this is exposing, which we also saw back in Ebola, is that when you have a major problem, not so much in China, but as this is going to spread in Africa, throughout Asia, in South America, in poor countries, there is no international resource to go help fight this disease overseas. We are incredibly dependent on NGOs, brave, amazing, fantastic NGOs, but under-resourced, under-empowered, understaffed NGOs. And we're going to see the pinch of this as this disease spreads in Africa and as this disease spreads in other poorer parts of the world.
Are you suggesting that such an organization be formed, and under whose auspices?
Yeah, so back in 2016, I wrote a piece where I laid out the pandemic threat and made 6 specific recommendations. One of those was to create a global white hat battalion. At that time, the idea was put forward by the Germans and to do it under the auspices of the EU. The UN looked at a similar idea, did some of this during Ebola, but ultimately wasn't really that successful with their efforts. We need a capable international response force that has the ability to deal with these kinds of pandemics, particularly in the developing world. And one other problem we're seeing, if you look at the current outbreak of Ebola in the DRC, in Congo, what's happened there is, even though we have a vaccine, even though we have all kinds of countermeasures to fight that disease now that we did not have in 2014, the presence of violence there, the fact that responders are getting killed, has really impeded the response. So as this disease moves around the world, there's going to have to be a security component to fighting this disease in unstable areas, in areas with civil conflict, in areas with large refugee populations. It's a combination of a global health response and a security response to protect the people who are victims and to protect the responders who are fighting the disease.
And in many parts of the world, including the United States, there are people who oppose vaccines. They don't want to see them deployed. If that is in fact the solution to COVID-19, how do we get that message across? How do we persuade people that vaccination is a must?
Jeanne, it's a fantastic question. I've said elsewhere that I think the greatest public health challenge we're going to face in this country in 2021 is going to be manufacturing, distributing, and getting people to take this vaccine. Right now, we're focused, understandably, on the science challenge. Can we develop a vaccine? Can we get it tested? Can we get it proven? What will be the prevailing vaccine candidates? And that's an amazing challenge. Ed alluded to this before. The scientific community is doing incredible, historic work on this front. But that's really just the first step. Making hundreds of millions of doses of this vaccine without displacing the manufacture of other critical life-saving vaccines is going to be a huge manufacturing challenge. And then, as you alluded to, once we get it made, we have to get people to take it. Now, this disease is so infectious, we're going to need a very high rate of vaccine compliance, perhaps as high as 90%, to get the kind of immunity you'd want, the herd immunity you'd want in this country. And to get 90% of the people to take this vaccine, it's going to be a real challenge. It's going to be a challenge in distribution. You know, we're used to in this country getting children to take vaccines and doctor's visits, using school attendance as a way of compelling that. This is going to be much bigger and much broader than that. When we see the level of vaccination rates for the flu vaccine in the 50%, we're going to have to obviously do a lot better. And that means overcoming the kinds of vaccine hesitancy and resistance you're talking about. It means persuasive messages from public health communicators, from non-traditional communicators. It's going to mean an incredible civil effort and civic effort to get the vaccine made, distributed, and into people's arms.
And of course, we don't have a vaccine at this point in time. You're familiar with the health infrastructure and living conditions in other parts of the world. What kind of impact is COVID-19 going to have in Africa, in Central and South America?
Yeah, I think that, as I said earlier, we're living through this here in the US now and really suffering mightily from it. And I understand why we're focused on it. We should be focused on it. That should be our first priority as Americans. I understand that. But as hard as this has been for us, when this starts to ravage countries that have much less advanced healthcare systems, much fewer resources, many fewer doctors, many fewer nurses, even less protective gear than we have, it is going to be devastating on those countries and devastating on those societies. You know, when we fought Ebola in 2014, 1 in every 10 people who died in West Africa was a healthcare worker. And that had a dramatic impact on the ability to fight the disease. It had a dramatic impact on those societies in the long run, because it means other healthcare services are still suffering in those countries years after the epidemic because of a lack of doctors, a lack of nurses. This is not a renewable resource. We can't just instantly make more doctors and nurses. It takes time to replenish those losses, beyond obviously the human toll of that. And so we're going to see really catastrophic impacts in places where this disease becomes widespread in the developing world, certainly until there's a vaccine. And then again, with the vaccine, they're going to have to make literally billions of doses and get it to all kinds of places. Now, the Global Vaccine Alliance, Gavi, has said that they are interested in taking on this project, but it's going to be a huge, huge project.
Ron, I'd like to get to a couple of the questions from the audience, if I could. Ryan Hayden is asking, how does our response change if President is reelected versus Biden winning? What's your response?
Well, as I said before, I think there's obviously, I'm a Biden partisan, I wear that on my sleeve. There's no objectivity here. But I think that there is a big difference between the two men and their approaches. And it starts with their willingness to put science first. Vice President Biden said very clearly that scientific knowledge, medical advice will drive his approach to it. He's impaneled a group of leading medical experts who advise him. He talks to them every single day about updates on the disease and about the policies he's putting forward. And I think that's a big difference at a time when you see the president trying to replace his scientific advisors, announcing that now an economic team will advise him on reopening the economy as opposed to listening to public health advice. I think that difference in terms of a belief in science as the touchstone of the response is one big difference. And then I think a second big difference is a belief in the role of the federal government. President Trump, ironically, both proclaims his unilateral and absolute power to shut and open the economy, but on the other hand, when it really matters in terms of driving this testing solution, driving the collection and distribution of protective gear for our healthcare workers, helping hospitals build responses. His answers, that's a state problem. It's up to the states to get testing fixed. It's up to the states to get protective gear. Vice President Biden's been very clear. He would use the Defense Production Act to take control of the supply chain, to have the federal government oversee the manufacturing of the tests and the gear that we need, and to make sure that's getting to the front lines. So I think those are two big differences between their approaches to this crisis.
Ron, we're almost out of time, but I want to ask you one more question. Bob Smith asked, why has the CDC been sidelined during the coronavirus crisis? We heard Ed Young's thoughts. Quickly, what are yours?
Yeah, I think it's a shame. I think that the CDC is our nation's leading public health agency. As Ed said, it's really the world's leading public health agency. When I worked for President Obama, we were quite proud of the fact that we helped launch and fund an African CDC. All over the world, countries model what they're doing against compared to our CDC. And so to take this great resource and to put it on the sidelines, I think that's a real shame. I hope the Trump administration will change its approach to that.
Ron Klain, White House Ebola czar under President Obama and an advisor to Joe Biden. Thanks so much for joining us here today.
Thanks, Jeannie.